So I think that a lot of the things that are difficult these days is that we're very busy and trying to provide good patient communication and keep a good rapport with your patient and spend the time necessary that it takes to build a good patient relationship. And at the same time, meet the demands of our practice in terms of volume of patients that we have to see and the overhead we have and the challenges we have with medicine the way it is. We've been using an EHR for 8 years, and we've switched EHRs. We're still in the process of switching now. But that's been a very useful adjunct to our practice. It's been very helpful in a lot of different ways, making our practice more efficient. So it does help us tremendously. Oh, well, it certainly does. I mean, we're orthopedic surgeons, and so, for example, we order surgery all the time. And in the pre-electronic medical record day, that involved writing out what we call a green sheet, where you write the order for surgery, and then you hand that to somebody, and then it goes to our authorizations department. So we would routinely lose 1 or 2 of those a week at least, and then you'd have a phone call from a patient 2 weeks later saying, well, when's my surgery going to be scheduled? And someone would have to go, oops, we didn't do anything about that yet. So the use of an electronic medical record and a practice management system dramatically smooths that. We don't lose those orders anymore. They get routed right to where they need to be without any difficulties, and have much better patient care and patient satisfaction because of those types of things. Certainly from a business standpoint it helps. Having a good practice management software is a big issue, particularly when you have a group of 8 doctors. You can't do things by paper and by hand, you just can't. And there's certainly major differences in the different programs that are out there in terms of ease of use. And for example, the previous program we were using, it was virtually impossible for me to make an appointment. You had to have knowledge that was not typical amongst physicians and go to a particular part in the program to get to it, and it was a royal pain in the butt. And with the EMR that we use now, if I see a patient on the weekend or we do something, I can just easily put that patient into the system, make an appointment, do all those things. And so I think meaningful use is a good idea. I do think that there needs to be something to push physicians towards doing what we do better. And there are a lot of physician practices who either are unwilling or haven't invested the time or effort to do anything electronically. The first step in that was, of course, several years ago when Medicare mandated electronic billing. So that pushed everybody kicking and screaming into the electronic age. And now this new set of rules is going to be pushing people further along. I think that, like many other government programs, it's going to be a little difficult to sort out exactly where it ends up and how hard or easy it's going to be to meet the criteria, and remain a little skeptical about whether they'll actually pay you, and all of those things. But it's very clear that we're all being pushed in that direction. Now there are bonuses for electronic prescribing. In 4 years, there's going to be penalties for not electronic prescribing. So those are the things that push us all this direction. I think it's a decent motivator. I have a group of 8 doctors, and there are 2 of us who currently have shifted over to the Aprima, the new software that we're using. And the other 6 have been, kind of reluctantly scratching along the way. And the funds have made a big impetus. Now they're all interested, And so I think it's, at least from my personal standpoint, it's something that's going to change our practice a bit. And I think that's probably true across the board, for physicians. I think it's a legitimate way to incentivize people to do electronic records. The difficulties come in that there's rather loose standards, and there's multiple products in the market, and there's different ways of implementing things. You also have very different, I shouldn't say it that way. You also have fairly restrictive rules about patient privacy. And so one of the things that we experience every day is the hospital has a certain electronic record system, we have a different one, and getting those two to talk to each other and getting permission from the hospital to get into their data and all that, it's exceedingly difficult. And so all of those issues about electronic transmission of data are going to have to be solved over the next few years.
Information exchange.
Yes. In terms of physician payments, I think that we've seen significant ratcheting down of payments to all of our healthcare industry providers. Hospitals, nursing homes, therapy practices, physicians have all been hit very hard with reimbursement decreases, and at the same time have seen a tremendous acceleration of expense. And there are certain segments of the industry that haven't been hit so hard that are actually contributing to expense. For example, like implants for hospitals and drugs and staffing and wages and those types of things. So somewhere very soon this whole system's gonna come to a real head. And I think that the federal government has to recognize that. I don't know if they have actually recognized that yet. And they have to provide some incentive for physicians to continue to take care of Medicare patients, for example, because if the reimbursement goes down any further and the complexity of taking care of them goes up any further, you just won't have physicians caring for them anymore. So anything that we can do from an electronic standpoint to simplify, to take over full-time employee work and turn it into something that's done in an automatic fashion to lower our overhead, those types of things are very significant drivers for doctors to change to this technology. So the incentive payments are one way of getting people to, shoving them in that direction. One of the more notable examples of our entry into electronic records 8 years ago was the day that I ordered an MRI scan on a workers' compensation patient. And a half hour after I ordered it, my workers' compensation gal came to me almost peeing her pants with excitement that she had the MRI scan authorized. And all that it took was for her to see the order that I had written, call the insurance company, get the fax number that they wanted it sent to, take it from the computer and fax it to them, and then get a response. And she did it all from sitting at her desk. And it took about 2.5 to 3 minutes to do, whereas previously it would involve waiting a couple days for the note to come to the chart, then getting it filed in the chart, and then faxing it to the provider, then waiting for a response. And much really greatly simplified her workflow. So that is the type of thing that EHR, I think, does for you if you apply. Certainly, my first advice would be do it. Like the Nike commercials, just do it. I mean, you have to. I think in order to stay in practice, you're going to absolutely have to, because the federal government's going to mandate it. At the same time, I think there's a lot of reasons, good reasons, why you should, because it makes your office substantially more efficient. It can make you more efficient. It gives you your information about your patients at your side 24 hours a day, no matter where you are. And it's tremendously better for your for your practice in that manner. Having said that, I think you also need to look specifically at what a program carries in terms of features. And sometimes we get swept up by a glitzy overview or a great orthopedic vocabulary that seems to have all the right words in it, and then don't look at what the different features are of the program and how efficient it might be for you and your individual practice. So I think you have to do a little due diligence to really analyze the programs well before you make a decision about buying one. So, okay.
That's
Great.
it.
Thanks.
Thank you. That was